Hello and welcome to Dental Health Matters, brought to you by the BSDHT. Today we're exploring how sustainability is becoming an increasingly important part of oral health conversations. More and more patients are asking questions about plastic-free products, low waste routines, and whether their oral care choices can reflect their wider values without compromising their health. I'm Rhiannon Jones, President of the BSDHT, and today I'm joined by Dr Simon Chard, dentist, educator and founder of Dr Simon Chard Oral Care. Simon has been at the forefront of conversations around sustainable dentistry and patient-centred oral health, and today we'll be discussing how dental hygienists and dental therapists can confidently support patients seeking more environmentally responsible oral care options. Hi Simon, thank you so much for joining us.
Thank you very much for having me.
So I'm thinking about sustainability in dentistry and what patients' expectations are. They're clearly changing. And I was wondering what you thought might have driven that change in patients about plastic waste and their oral care products.
Yeah, well, I think there's a lot more awareness nowadays than there used to be. And I think television really, as well as social media, plays a big part in that. It's actually David Attenborough's 100th birthday today. Certainly for me, when I first came up with the idea of Parlour, our brand focused on plastic-free oral care. The shows like Planet Earth, Blue Ocean. At that time, Plastic Ocean was another documentary that came out on Netflix. And then more recently, I think there's a new show on the plastic detox and the impact of microplastics on our food system and on our bodies. I think all of those shows go to bring awareness to these things, because we live in a world where we're surrounded really by single-use plastic items, and I think until it switches in your head, you just see them as something that's always been there. There's always been a bottle of fairy liquid by the sink, for example. You barely see it in your day-to-day life because you're just busy living and doing what you do. So I think oral care products have traditionally sat in that same category where you just have your standard products there that have always been there and you sort of buy it on autopilot. That is, I think, the old consumer habit psychology, but I think more and more nowadays there is a big focus on not only what is this product coming in terms of packaging, and what impact is that going to have on the planet now and moving forward, but also what ingredients are in there and how ethically sourced and wellness focused are the ingredients that I'm finding in these products. Yeah, quite shocking when you do actually read the ingredient deck of a traditional oral care product. Many of the ingredients in there you'd have literally no idea what they are, because they are lettered and numbered as things to sort of almost confuse. So I think I think media and social media especially has really helped to bring awareness to this problem.
I'm thinking about how many I'm a clinician still, how many of my patients are curious about plastic-free or low-waste oral care products, but they're probably really unsure about where they can start. Like you say, it's such an array in a supermarket of what's available for them. How can we support our patients as clinicians to have those conversations, but with confidence?
Yeah, well, I mean, I think traditionally, and this is not wanting to talk about Parlour too much, but this is one of the reasons that we felt that we wanted to exist. Traditionally, what you would find is that the same brands that were trying to be more sustainable would also remove various ingredients that we need to support better oral health. What I would very fondly describe as hippie brands or big multinationals, and those were the only options available to people. And so the reason why we created Parlour was that we wanted to hit that sweet spot between science-backed, evidence-based, ingredient-led. So yes, we're going to have fluoride. No, we're not going to have SLS. No, we're not going to have artificial flavorings, titanium dioxide, those sorts of things. But yes, we are going to be plastic free, and we are going to be palm oil free, and try and make those ethical decisions. So science-backed and ethically minded, we felt didn't really exist in the industry. And so that's why we tried to sort of fill that void, so that professionals could recommend products that not only really work for our patients, and we've tried to make them work to the best of modern science's ability, with the active ingredients that we have in our products, but at the same time just having a complete non-negotiable position on various parameters. So none of our products have any plastic in them, 0% across the whole packaging line. And that is something that is really hard, if I'm completely honest with you. I mean, our new toothpastes are made out of aluminium. They're infinitely recyclable. But even the lid is aluminium and the nozzle is aluminium. And all of these things come at not only a cost, but also a challenge in different ways, which most brands aren't willing to make those choices. Our focus is very much to just being simple and authentic in the way that we propose this, and that's why we're a B Corp certified brand, which is something that something we're really, really proud of. And it's great to see other brands in the dental space becoming B Corp certified. I think brands like Denplan and Envisage, a new corporate group, they're B Corp certified, I believe. For those people that haven't heard of B Corp, B Corp's basically trying to make business better for people, better for the planet, better for animals, make it a force for good, as opposed to a commercial focus that is at the detriment of the environment and the organisms that live on it. So that's something that we're really, really proud of.
And do you think, it was interesting to see your sample there. I quite like the aluminium tubes, but maybe we should be trying it. That's the other thing, isn't it? You know, we would have more confidence to talk to our patients about these products if we were trying them ourselves, because it's all too easy for us as clinicians to be given samples of other brands and just use them. So it's not often I have to buy a toothpaste because I have that many, but it might mean I never get a chance to try your product, and that would give me more confidence to talk to a patient about it, wouldn't it?
Look, at the end of the day, we as dental professionals, we don't often get a chance. Well, I do this every week now, but most dental professionals don't get a chance to go to the supermarket shelf and see the absolute overwhelm that consumers have to experience when they get there. Gimmicky marketing claims, charcoal, purple toothpaste, whitening, sensitivity, gum health, fluoride free. It's a barrage on the senses. And so, I completely agree that actually exposing yourself to that is really eye-opening. And obviously for me, I mean, our products are on the shelves of Sainsbury's, Waitrose, Boots, Whole Foods, a couple of new ones coming later in the year. And so I'm looking at those shelves all the time because I'm obsessed, and I love to take my kids down to my local Waitrose and show them Daddy's toothpaste. It is, I think, an experience that we need to consider for our patients. And obviously, if people want to try Parla, please do message me on Instagram or whatever, and I'll be more than happy to send you some out. But I wasn't saying, I was on the Oral-B TV advert back before I started Parla. I had never bought toothpaste in my life. Because you just get it for free, don't you? You just use whatever's there. But I think we need to be more considerate of the impact that that's having, not just our own personal consumption, but actually all of those free plastic samples that are dumped on our front doorstep. They still dump them on my doorstep, which is quite hilarious, given that I have my own oral care competitor brand. But those little tubes are literally used for a week, and then they last for 500 years. Every single one of those still exists somewhere on the planet. And they can talk about recyclable plastic tubes until they're blue in the face. Only maximum 18-19% of those are actually getting recycled, if we're lucky. And even if they are recycled, they can only be recycled a finite number of times before the plastic denatures and it ends up in landfill anyway. So that is not a real solution to the problem. It's greenwashing. It's better than single use, don't get me wrong. It's a step in the right direction, but it's not a real solution to the problem. And that's why we just have a simple rule, no plastic, because if you watch Plastic Detox on Netflix, or if you've looked at any more modern research on microplastics in the human body, I think it's like 99% of us have microplastics in our bloodstream, or certainly 90% plus. And for me, with the rapid rising rate of cancer, bowel cancer, especially in young individuals, I don't want my kids living in a world like that, or a world where the ocean is ruined by microplastics or physical plastic as well. And so for me, I sleep very well at night, and I feel we're making a really positive impact with Parla, that we just don't have any plastic in our products. And we continue to try and make our products more and more sustainable and have an even greater impact. But that rule will always be the same. We will never use plastic in any of our products. And I'm really proud of that. And no one else is doing that, to be honest with you. We are the only plastic-free toothpaste at Sainsbury's, at Waitrose, on Ocado. I think in grocery across the UK, we're the only plastic-free toothpaste.
And you would want your patients to know, and possibly the only way they will know is the clinicians giving them the options, because they don't read the back of tubes. So even if that tube is recyclable, they don't know it is, so it goes straight in the black bin. Yeah, it's a shame, isn't it?
You've always thought to yourself, oh, I know my toothpaste tube can't be recycled. And that recyclable plastic, if it goes into landfill, is still going to break down into smaller bits of plastic, which is still going to make its way into our ecosystem. And that's, if you think about how many you use across your lifetime, I mean, it's 20 billion a year across the planet. But even for a single individual, we had this thing, we won the Sky TV Footprint Fund Award last year. So we won £200,000 worth of TV advertising. And we got this big fish tank, glass fish tank, and we had a toothpaste tube amnesty project that we did, where we got people to send us their old toothpaste tubes so that we could use them for marketing and that sort of stuff. So we had a whole person's consumption in this big fish tank. So it's about 1,000 plastic tubes, and that's about as many as one person will use in their lifetime. But when you see it in front of you, you're like, oh my goodness, think about that times by the 8-9 billion people that live on this planet. It's quite a shocking thought if you sort of imagine that you had to leave it in your garden instead of sending it somewhere else.
That's a good analogy, actually. So I used to teach, and I really enjoyed the element, the sort of year 1, year 2 of the younger dental students, and talking to them about sustainability in dentistry and setting them off with projects. And it was not on their radar at all until we mentioned it. And to say to somebody that every single toothbrush you've ever used is in the ground right now, and it doesn't look any different to how it did when you put it in there, and it will still be here hundreds of years after you've gone. Those sorts of, they're really impactful moments, aren't they, for somebody? But we now have a generation of dentists and dental clinicians who feel the same way. They are looking for something, they've never thought about what's in a toothpaste. As long as it's got fluoride, please use it. Unless you've got sensitivity, maybe they tweak it, but they've never really thought. We used to ask them to design a toothpaste. Go and design one yourself and bring it back and tell us why that ingredient. Really makes people think. And I had other lecturers working with me, maybe just given to me for the day to help run a workshop, and even they, really experienced lecturers, had never considered or read the back of a toothpaste tube to really think what's in it and how it's made and how it's manufactured. So I think this is such an important topic to really start, not for you've been thinking about it for years, but for some people to really start thinking about, because there will be people who will question what's in a toothpaste. If we're recommending something new, they want to know what's in it. How do we balance sustainability with efficacy so that we're ensuring really that all these recommendations that we give are clinically sound and evidence-based?
Well, I think you've got to just go with a brand that actually knows what they're talking about. I mean, you don't have a lot of plastic-free toothpaste options to go for, is the reality. We first launched with toothpaste tablets, which was a very new form factor, but in its essence, dehydrated toothpaste in a tablet form. So just the same ingredients, but without the water, and then the saliva with a wet brush turns it into a paste. Obviously, we're now in a more traditional paste format, but still with the same ingredients and the same plastic-free execution. But I think at the end of the day, you need to go with a brand that you've got trust that the individuals creating these things actually care deeply about oral health. I mean, there's so much marketing out there. There's so many different ways that studies can be cut, studies done internally by these brands, obviously with a marketing aim at the end of it as a primary driver. You've got to question the ethics of the companies that you're looking at. I mean, one of my biggest bugbears at the moment is brands using the hydroxyapatite studies in terms of the new randomized double-blind control studies looking at hydroxyapatite versus fluoride, and using that as an opportunity to create fluoride-free products with a woefully inadequate level of hydroxyapatite, and marketing that against hydroxyapatite, because nobody vets how much hydroxyapatite they're putting in. The study, I believe, said that it needed to be 10% plus to get an equal efficacy to fluoride. but nobody checks that. So they use that research to their marketing advantage. They don't put the hydroxyapatite in at a larger level, at the right level, because it costs too much money for them. And they want to price it cheap and sell it they want to make it cheap and sell it for a lot of money. And so I see that in my own clinical practice, because I'm still a practicing dentist myself, as patients coming in who are on these ethical products that say they have hydroxyapatite in, which is a fluoride replacement, but they've got rampant caries, even in really well-maintained diet situations, because it's really hard to avoid refined sugars, number one. Number two, there's, especially in kids, there's a huge amount of mouth breathing, and my wife's a big proponent of talking about sleep disordered breathing in kids, because that's a huge issue. But they're just marketing against the studies and not actually, nobody is really vetting what levels of the ingredients are going in there. And so for us, if we ever create a fluoride-free product, I would make sure that the levels within that are at a level that really work. In this toothpaste, for example, it contains hydroxyapatite and fluoride, but it contains hydroxyapatite over 5%, so that we can make claims around strengthening and hardening of the enamel by 65%, because that's what the research shows. So again, it comes down really to how much you trust the ethics of the companies that you're dealing with. And the further away the founding team are from the products that you're providing to your patients, the less confident I would be in terms of actually what's being delivered there. Because as I've already mentioned, the big multinational brands, yes, they'll make sure they have their fluoride in at the right concentration. Yes, obviously their products, they want to have lots of research against them. But if you look at the ingredient decks on most of these products, all the fillers, the propylene glycols, the C1974 or whatever the numbers are, the titanium dioxide, the SLS, it's all just designed for maximum profit for minimum efficacy, really. You've also got to realize that if you're going to sell a toothpaste for £1, how can you make anything for £1 nowadays? I mean, yes, there's economy of scale, but you get what you pay for at the end of the day. And if you're recommending these products to your patients, there's better products out there. I mean, you really, if you want to do better, then it is going to cost a bit more. That is the reality, which is a trouble, because obviously we want better oral health for all, and some people can't afford to pay any more than that. But we've got to be realistic at the same time, I think.
That's very difficult for the patients to read the back of boxes and make any sense of it. So it's almost our job as the clinician, isn't it, to understand that, to know about how to critically appraise a trial and really understand it and read the ingredients, because they trust us, thankfully.
We've got a wonderful community of dental hygiene therapists, about 400 I think now in our WhatsApp group, who believe really passionately in what we're doing, and want to recommend it to their patients. I mean, we just found out just before the call today, actually, that we've been shortlisted as a finalist for the Grocer Health and Beauty Brand of the Year. The Grocer Gold Awards is like the Oscars of the consumer brand world. Wild Deodorant have won this award before, who I'm a big fan of, and all of the guys in that WhatsApp group were sort of sharing it with their friends and telling everyone about it. So it's really exciting to have that community, because we are a small community in dental, and anyone that knows me or will know that I'm only going to put my name against something that I really believe in, and we're really proud of what we've created at Parlour.
Yeah, you should be. It goes on nicely, actually, to my next question, which talks about values, because I think our values and our identity often shape our oral health behaviours. How do you see that influence in everyday oral care habits, and then the product choices that they make as well?
If I'm honest with you, Rhiannon, in terms of sustainability, our experience with it is that back in 2020, when we first launched, people were much more focused on it. Unfortunately, I think over the last 5 years that we've been trading for, the desire for sustainability as a primary rationale for purchasing decisions has waned somewhat in the commercial sector. I've seen that with investors, I've seen that with retailers, I've seen it with consumers as well. Now, that doesn't change how we operate in terms of how we create our products, but in terms of the language that we use, we talk more nowadays about wellness and ingredient choice. Again, the ingredients in our products have never changed. They've always been brilliant and wellness focused, but it's just, I always say it's like how you, I don't know if you have kids, but with my kids, if I want them to have their spinach, I'm not just going to put some spinach on their plate and say, eat your spinach. I'm going to blend it into a lovely smoothie, and then I can get them their greens and their nutrients in a way that is palatable for them. So that's an analogy for the way that we focus to our consumers. Yes, we talk about whitening. Yes, we talk about wellness-inspired ingredients, but we always have plastic-free as the main focus for us that we're trying to achieve. So in terms of the value set of the modern consumer and patient, I have to flip between customer and patient. If I'm talking to a retailer, I'll be talking about patients. If I'm talking to a dentist or a dental professional, I end up talking about customers. So I always get it the wrong way around. But in terms of the modern consumer, I think they're very focused on what's going into their bodies, as they should be. I mean, I'm a big biohacker myself. I love looking at longevity and supplementation and the sourcing of my food. And I think that's just going to get more and more relevant for patients. They will want to know what's going into these things. The fluoride-free conversation is going to continue to grow in traction, rightly or wrongly, but brands will need to provide better fluoride-free solutions, I think, because someone that is passionate about fluoride-free is always going to go fluoride-free. You can try to change their mind, and a couple of fillings might change their mind, if that's what's required. But we have to be respectful of people's opinions as well, even if professionally and clinically we don't necessarily see the research supporting what they're saying. But I always like to have, one of my favorite quotes is strong opinions loosely held. And I like to speak passionately about what I believe in, but I'm also open to changing my mind if new information presents itself. And I think all of us as dental professionals have a responsibility to do that. We need to be careful not to be swung in the wind by the latest social media influencer. But equally, new information might present itself that says that fluoride actually isn't so good for the body. And if it does, then we should be ready to change based on that research if it's robust enough. Anyway, all of that is to say, to answer your question, I think that wellness and ingredient-led approaches will become more and more important in our industry in terms of the products that our patients want. And that is our big focus at Parlour, is providing the best quality of ingredients at the right concentrations, hydroxyapatite, probiotics. The oral microbiome is obviously having a big increase in awareness for the consumer. Not quite as fast as I would have hoped it to. I mean, we've been talking about it now for quite a few years. The gut microbiome has obviously got huge public awareness, but the oral microbiome is still somewhat lagging behind. But who knows? Maybe we'll get there eventually.
One podcast at a time.
That's it. Yeah, exactly. And I mean, Victoria Sampson did a great job on Diary of a CEO to bring attention to that that microbiome and the link, obviously, between the oral microbiome and the rest of the body's systemic health.
But when I'm having a conversation myself with a patient about sustainability, we have to be mindful of the demographic of the patients that we look after, because some have very different priorities, don't they? Their access to products is different, the financial situation. I'm just wondering how we can keep it practical but non-judgmental, and what advice you would have to dental hygienists and dental therapists with regards to that.
Well, I mean, the problem is in general that sustainable products tend to be more expensive, and we're not going to be able to resolve that issue. My view on price in general is that people will spend money on the things that they value. And you will oftentimes find that people will value certain things over their oral health. They'll be happy to spend £1,000 on a flat screen TV or on a new iPhone, but not on going to the hygienist, for example. And so that's not something that's under our control as clinicians. In terms of planetary health, it's, I think, all of our responsibilities as human beings living on this planet to do our best. The more of us that can make conscious purchasing decisions or conscious recommendations, if you're a healthcare professional, in terms of ingredient selection and in terms of packaging choices, it's up to the patient as to whether or not they are willing to accept that as an option. For us at Parlour, we have our enamel protect range, which is £6.95 as a RRP. It's more like £4 on subscription. And oftentimes with our retail partners, they'll discount that right down as well to around the sort of £4 mark. That is, with the way that the cost of living crisis has impacted the world, very much within the normal range of toothpaste nowadays. Your Sensodyne, your Oral-B's, your Colgates, most of those are sitting around that £3, £4, £5 mark now. And so it is possible for individuals, even who don't have 10, 11, £12 to spend on a really premium toothpaste, to buy something better for their health in terms of cleaner ingredients and better for the planet in terms of being plastic free.
Making assumptions can be dangerous, can't it? There's no harm in asking a patient, how important is it to you that the products you use are sustainable, can be recycled, have been made ethically? Very few patients would say, oh, I don't care at all. And then when they say, oh, yeah, it's really important, that is your opener then. It's just that, well, we could have a conversation about how that's changing in dentistry. So it's there for us to talk about, isn't it, really, now? It is for us.
It's the same what I say to my associate dentist at the practice. I always tell them, don't judge a book by its cover. I mean, if a patient needs a full mouth rehab, it's your responsibility to recommend them that they need a full mouth rehab. You shouldn't make any judgments about whether or not you think they can afford it or not. That's not your place to make that decision. You've got to provide the information, and I think that's what we are as professionals. We're information givers. We don't make decisions for our patients. I can't control my kids, never mind any of my patients. And so I think you've really just got to do your best. If you care deeply about the planet and protecting it from plastic and protecting the oceans from plastic, as I do. I mean, I created this brand a year after my first child was born, and for that very reason, that I wanted to protect the ocean for her. And I've now got, as I say, 3 kids. But if you care deeply about these sort of things, then you've got an opportunity to make these recommendations for your patients, and that's what we're here for. That's why we're on the supermarket shelves. It's very difficult being on the supermarket shelves, believe me, fighting against these big brands with infinite pockets for that space, which is limited. Is really tricky, but that's why we're there, and why we continue to fight for our right to be on those shelves, so that great people like you and other members of the dental hygiene therapy team, who really are the main people making these recommendations. Certainly in my practice, it tends to be the hygienists and the therapists that are making the oral care recommendations. If they're able to recommend something that's better for their patients, and better for the planet as well, then brilliant.
No, you almost need a champion, don't you? I can see that in each practice it would be great to have somebody who had that as a role. I
think it's a really great idea. The BDA has some really good advice for in-surgery sustainability activations. I did quite a lot with Denplan a few years ago talking about that, because there's loads of stuff that we can do just to minimise our impact on the planet. I know it seems like, it's just one practice, but actually you think about the footprint of all of those practices across the country. There are certain things as dental professionals we can't help but be wasteful in. Certain things have to be single use. There's no getting around that. But at the end of the day, if we make everything single use, then we won't have a planet to live on for these people to be able to inhabit. So we need to try and make conscious decisions in our own practices and our own homes first, and then obviously with our recommendations for our patients equally as important, because each of us sees thousands of people a year. So the impact that we could have as an ambassador for better choices is really really large, bigger than we think, I think.
Yeah, so even the samples that we give, the things we use to demonstrate, just being that little bit more mindful of, I did demonstrate this last time, do I need to use another product, or can I use my words and my persuasion? Yeah. So, I mean, finally, Simon, I was wondering, for dental hygienists and therapists listening who want to respond better to patient demand for sustainable products, what's one thing they could start doing in practice next week?
There's not really one big thing, Ren. I think this is always a cumulative. We always talk about one small change at Parlour, and I think it's all about those little small changes that you make all along the way. Even thinking about, right, how am I getting to work? Am I going to cycle? Am I going to carpool? Am I going to drive an electric car? Am I going to take public transport? When I get to work, am I going to, my food that I buy on the way to work, am I going to buy it in loads of plastic packaging that is going to last forever on the planet? I think it builds up throughout the day. As you mentioned before, like speaking to your team about, right, okay, 3-in-1 tips. Should we look at what the metal reusable ones look like? Can we go for, I don't know, bamboo cups instead of plastic cups for the rinse? Just all of those little things. I know they seem silly and insignificant, but actually they all build up, and they can make a really big impact. If all of us did it, then the cost of those things would also come down, and therefore it wouldn't be you making financially challenging decisions. It would actually give you an opportunity to make that decision and make it a no-brainer. Oh, it's actually cheaper for me to choose the more sustainable option. Brilliant. And I mean, same with us at Parlour. If obviously the bigger scale I achieve, the better unit cost I can achieve, the cheaper I can sell my product, the more people I can impact. And it's a positive flywheel instead of a negative flywheel. And so it's the same, I think, for the choices that we make around the practice as well.
Oh, thank you so much today, Simon. It's a topic that I'm very passionate about and didn't know enough about until I started sort of teaching it a little bit more and learning. I think everyone should start learning more about what goes into the products that they are recommending to their patient. Not just the active ingredient, but all the other ones in there as well.
They'd be surprised, I think, if they actually looked at them, and they probably won't know what a lot of the words are. And then if they look at what they actually are, they'll be even more surprised at what they're recommending their patients put in their mouths every day, or even what they're putting in their mouths every day.
Exactly. Yes, true. No, I'm really appreciative of your time today. Thank you so much. And as you say, if people want to try, they can buy it. You've named all the supermarkets and you're on Instagram as well. So
I'll give you a special code. I think my code's Dr Simon 15. So they can use that on Parlour's website, parlouroralcare.com. And equally, if you want to join our community, then please do send us a message. It's just for hygiene therapists. We're going to be doing more and more events. Hopefully come to your guys' conference later in the year.
Yes, that'd be fantastic.
Try and connect with you guys as much as we can, because for us, you're our people, you're our core community. We really want to help provide better products, work with you to improve our products. What other ingredients should we be looking at? What are the products? All of those things, we're constantly looking, right, how can we make even more of an impact? And we want to work with a professional on that. So please do get in touch if you want to.
Well, we like to be listened to as much as we like to talk. That's great. Thank you so much, Simon.
Thanks for having me.
That brings us to the end of today's episode of Dental Health Matters. Thank you so much for listening. We hope you found today's conversation helpful and informative. If you enjoyed this episode, please remember to subscribe, leave a review, or share with someone you know might benefit. See you next time.